Hello. She's with Ed right now, but she'll be up here later. You can put it inside there.
Okay.
Morning, everybody. My name is Cheryl Strathman, and this is the Public Health Committee meeting on, what is the date today? Wednesday, March 20th. And on this International Day of Happiness, I would like to call this meeting to order. Please call the roll.
Juby here. Silva. Tarver.
Tarver's here.
Williams. Young.
Here.
Sanchez.
Sanchez present.
And Strathman.
Strathman here.
You have an in-person call?
And we have two remote requests. Excuse me. We have two remote requests from Mr. Tarver and Mr. Sanchez. Is it all right with everybody that we let them in? Yes? Okay. Good morning, Mr. Sanchez and Mr. Tarver. Welcome. Okay,
Good morning,
I would
thank
like
you.
I would like to ask for a unanimous consent for the minutes from February 21st, 2024. Whichever. Okay, thank you. Unanimous consent is all right with everybody? Good. Okay, now we are going to start with public comment. And I have some lists here of people who sent in a request. Did anybody sign up here? Oh, okay. Okay, and I show that none of these are on agenda this morning. That's correct, is it not? Everybody, yes. Okay. Okay, top of my list, I have Chris Lawson. Mr. Lawson. I don't see him. Okay, the next one I have is Michelle Baytag. Is Michelle here? There's a lot of crazy traffic this morning, so maybe that was it.
Yeah.
It's crazy. Next, I have Brian Anderson. Oh, at first I thought somebody was playing tricks on me. I didn't see you back there. Good morning.
Good morning, Brian Anderson, Sugar Grove. I just walked up here. I believe I signed up for non-agenda,
Yes.
not the agenda.
That's correct. And we had nobody on agenda to speak, so we're all ready to non-agenda.
I'm sorry. My hearing is fading. Brian Anderson, Sugar Grove, Illinois. You know, I had a couple of talking points, but you'd mentioned International Day of Happiness. And it just dawned on me, if I can find it here, because many times at many of these board meetings, they do the pledge, they have someone do an invocation. So for those of us that anchor in Jesus Christ, I'm looking at Nehemiah 8:10. The joy of the Lord is my strength. I don't need one day a year. I have joy every day of the week. That's a good thing to have. Every day of the week, 365 days a year, I am thankful and joyful. I don't need a day to remind me, but I digress. So I came to talk today. I know that there is a special board meeting on March 27th, 1 o'clock. I think we're going to be discussing, hey, do we use ARPA funds? Do we try to build a building 30, 40, 50 million? I'm not going to get into that. I think that why I'm here today is prudence of each and every board member, using, managing fiscal responsibility. You know, when I looked at the agenda and dug down into the notes, we spend a huge amount on payroll. Now, after spending 30 years in business and having the privilege to work with hundreds and hundreds of team members on compensation committees, sometimes you have to go, you're doing a great job, you have reached your cap, there will be no more pay increase. I've been coming to these board meetings now for a year, regardless of the committee, and it seems like, yep, pay increase, pay increase, pay increase. I'm encouraging this body and this board because I believe in, I know you can't respond, but you could in an email. Unlike many counties, there's a health board. I think this body does a lot of the work. So I'm looking for fiscal responsibility. I'm also looking for this group to keep the main thing the main thing. When you go on the Kane County Health Department website, it should be about health and wellness.
Thank you, Mr. Anderson. Your time is up.
Thank you.
Okay. Did I see Ms. Beteg come in? You have 3 minutes.
Thank you. Michelle Batag, St. Charles. Kind of along the same line, I'm just asking for fiscal responsibility. This economy is tanking. People are suffering. We're still waiting on all these other projects that could be used as ARPA funds. We are compassionate. I'm hoping to hear that you do have a new facility that might fit the needs of Kane County and that we could spend a lot less. That would be very encouraging. And I know that you guys are diligently looking at that. I appreciate that. I am concerned about the influx of non-Kane County citizens coming into our county. And I hope that you are keeping the focus on Kane County citizens and not on people that do not live in Kane County and trying to help them with their needs. Yeah, anyway, I'm just concerned about a huge building that we don't need. And I'm hoping that it sounds hopeful that you guys are looking at into other options. Thank you.
And next we have Lori Powell.
Good morning. I'm Lori Powell, Keene County resident for the past 20 years. So I'm also here to encourage you to vote no for the proposed new health department building. The Kane County Public Health Department has only been in existence since 1985. There seems to be about 74 positions and about 8 vacant positions. And when looking at that financial reporting structure from the January 17th meeting, there are many programs that are just funded by grants. The rest of the budget is around $2 million comes from us, the Kane County taxpayers. We need to stay in that budget. When we really are honest about the function of the public health department, it is a call center and provides short-term programs. It does not make sense to build a very expensive building, which puts us into debt. And it's extremely unsettling to partner with the federal government for this project. Kane County can do so much better. We don't need the federal government telling us what to do. That's what got us into this mess. COVID was a planned event. The federal government telling us what to do. The federal government distributed bribe money and the board accepted this money. Please begin examining all of this grant money. Some of these programs are actually funded by pharmaceutical companies who are making money and stealing from the taxpayers. In February, I attended Bill Foster's town hall event. He was definitely reading from a script. The main message was to cure drug addiction and mental illness is more drugs. Who do you think is benefiting by pushing these so-called life-saving drugs? So say no to the public health building, and our public health department can do so much better. Thanks.
Final speaker that I have is Mark Schrage.
Good morning. Good morning. This is a continuation of what I tried to get done the last meeting, so I'm only going to actually do a couple of the paragraphs. If the Kane County Health Department truly wants to have an impact on the health of its citizens, it would do much better to allocate the current surplus of 24 million ARPA funds to cooperate with the city of Elgin and or other municipalities that might have identified lead levels of at least 15 parts per billion in more than 10% of the tested homes. At a cost of $13,000 per home, they could more than triple the efforts of the city of Elgin and take the lead service line out of 18, almost 2,000 more homes. And they might even reach more homes if they issued a tax credit to those who undertook doing at their own costs. I mention Elgin here because I live there. However, I know that Aurora, Carpentersville, and other municipalities are also faced with the challenge of changing lead service lines. The city of Geneva offers reimbursement to homeowners at a cost of $6,000 to $7,000 per home. I don't have the exact details, which would even multiply more of the funds you have if you offered a similar program to the whole county. If the public health department is really cooperative and does not duplicate what others are doing, do you really consider it a good investment to spend public funds on a facility that would mostly house meeting rooms and provide vaccine deposit supplies, while on the other hand, you could have a major impact on at least 2,000 homes, more than tripling the current effort of the city of Elgin, for instance? If not, on a project that already, and it's also true that this project has already been approved by meeting the ARPA requirements, would not run the risk of needing to return the funds if the building is not finished on time or many other possible scenarios. Lead causes insanity. Lead causes violence. Lead causes birth defects. It's a no-brainer.
Okay, that concludes our public speaking. So moving on to agenda.
There's 2 people who signed in, myself being one.
Where'd you go get that one? Sorry, I didn't know there was a sheet up there. Hey, Kim Sieber. You'll have 3 minutes.
I don't need 3 minutes. It's just pretty basic. I want you to be fiscally responsible. We don't need a huge, how many $1 million building for our health. I don't want the government in charge of my health. I want to be in charge of my health. You know, people who need help financially with their health, there's Medicaid and other programs federally. We do not need a big, gigantic building. I mean, utilize, if you want to do something, utilize the buildings you already have in the government. I want less government. I don't want more government, and I don't want them to be in charge of my health at all.
David? Yes. Mhm. You have 3 minutes.
David Young, I just wanted to bring up a couple of articles that I saw recently. One was from March 10th. It was from Breitbart, and it says health authorities in Chicago, Illinois reported a second case of measles in the city Friday, this time in the same migrant shelter where a 5-year-old boy died in December. And it goes on to talk about the outbreak of measles potentially in this center. It's in the Chicago Pilsen neighborhood. My cousin lives there. But they talked that there was an illegal child that was here, and he brought the measles and exposed us possibly 1,876 people in this center. So I bring this to the attention of everybody to let you know that these individuals that are coming over from our border are coming in with potential diseases that we don't even know about because we've been vaccinated against measles, polio, all this other stuff. But now with the influx of these illegals coming in and going into Chicago, that's something we're going to have to deal with. So I wanted to bring that up. The Illinois Department did make a statement, and they did say they were going to start to look into it and test these people in this shelter and also vaccinate them. So that was part of the article. The other thing I wanted to bring up was March 17th, there was an article, ended up coming from the Epoch Times, and there were over 148 pages that were released by the CDC based upon a FOIA. And the request was the cases involving myocarditis as it relates to the COVID vaccines. And they released 148 pages. And in this article, March 17th, they showed the 148 pages. They're all redacted. Every single one of them. So I thought that was very odd. So I don't know why. Maybe there's hiding something, who knows? But I wanted to point out something in the very small amount of time I have left, is that there is an open VAERS report. VAERS means Vaccine Adverse Event Reporting System. And there have been over 28,000 reports of myocarditis reported on that VAERS website that I've sent to everybody on this committee. So thank you.
Okay, that concludes our public speaking this morning. Now, next we go on to agenda, and the reports are attached. Are there any questions about the financial reports? Okay. And now next, animal control. Good morning.
Good morning, everyone. All my reports are on file. If anybody has questions, please let me know. I'm just waiting for, yep, perfect. Our first half clinic dates have been released. We're very excited about this, with our first clinic being the end of April, April 27th. It's a Saturday. We just remind people to note that the slight increase for this year's prices with the vaccine, or excuse me, yes, with the vaccine going from 10 to 15. And we just want to make sure people are well aware of that. So we're starting to hit the campaign trail, got it out to Julie and her wonderful crew to release a press update. We got it out on our website. We got it to multiple senior groups. We're starting to get it out to the libraries. This has just been a service that has grown every single year for people in this county, and we're excited it's back again. We are continuing with the drive-through style. People do not have to get out of their cars if they don't want to. If there's those people, they feel more comfortable, we're willing to work with them. We try to make it as flexible and as easy as possible for people. So it really helps and keeps the animals separated. Everybody stays safe. Then the second issue, I'd like to go back and clarify some issues from last meeting if possible. So we discussed possibly bringing low-cost euthanasia service to this county. The service is an end-of-life service. This service is for animals that are severe disease, severe behavior, not puppies, not kittens, not just because. This is a service offered by other agencies in the area. We're just trying to do our part for Kane County instead of sending animals and people from Kane County to other counties to be able to utilize a service. We're trying to make it available here. The hardest decision people have to make in their lives can be the decision of euthanasia. The last thing these people need is cost standing in their way of doing what's right for their animal. Sorry. I think if I walk you through the process, everyone will understand a little bit better. Someone has to make this decision on their own. They contact Kane County Animal Control. They speak to someone over the phone. This is their first interaction with someone from my agency. Everything's discussed, the policy's discussed, reasons are discussed. A date and a time are set that this person comes to our facility, pulls to the garage area, does not have to interact with anybody at the front desk. They then meet with two different members of my staff, one who's going to handle the paperwork side, one who's going to handle the animal itself. An evaluation is done again on the situation, on the animal, on the condition. Then a third person has to come along and make that final decision on this animal. This is not a mandated service. We do not have to do this. If the board chooses, we do not have to do this. This is a service we're trying to offer to those people that can't afford the rising cost of animal care and want to do what's right by their pet. That's all we're trying to accomplish. We have policies in place that protect any animal that is accidentally signed over, that is given to us, that is evaluated to be a very happy, healthy, wonderful dog that could be saved, could be helped, could be rescued. We don't expect it to get there, but if it does, we have safety measures in place to protect that animal. I would love to discuss this further with anybody that would like to. If anybody has questions, please let me know. But ultimately, because this is not a mandate, this is a board decision, and I will support whatever decision the county feels is best for its people.
Thank you for that clarification. Yes, Dr. Silva, question
Good morning.
or
Actually,
comment?
it's more of a statement, and it's going to be a long one, I think. First of all, thank you for everything that you do. I don't think a lot of us even understand what animal control department was like before you came. I am thrilled that you do the job that you do and that you have the compassion that you have. This was unfortunate because it is not what happened. It is not what said. And it really hurt people on a national level, on a state level, friends, family, dog lovers, cat lovers, animal lovers. And what that does is it takes away from the issue that these animals are suffering because we are suffering in the ability to care for them because there are a lot of COVID animals. We all know this. Folks are burdened with taking care of animals in a difficult economy. So it takes away from the issue. When someone from another state has to email me because they think I'm going to kill animals, if they're that passionate, that takes away from the time that they're giving to their shelters, to their local animals. So it's a very painful subject. It takes time for you to respond to all of these questions and comments when your primary goal, I know, is to take care of staff, take care of Kane County citizens, and of course, take care of the animals. So I am thrilled that we have an opportunity to clarify and really thank you for the work that you do.
Thank you.
Thank you. Any other comments or questions? Okay, yes, Mr. Tepe.
Thank you, Madam Chair. Tepe here. I don't know how many of us got phone calls on this issue. I did. I think it was blown out of proportion by the press and assumptions made by people.
Mr.
And I
Tepe, could you
assured
speak
them-
into your microphone a little more, please?
Boy, very rare for me to be quiet. Anyway, I think it was certainly blown out of proportion. When I was called, I said, you need to understand the gentleman that's in charge of this organization. You couldn't find someone that was more compassionate, loving of animals. And, you know, there's absolutely no way that this would happen in a manner that was inappropriate, and he would see to it that was that way. So I'm glad, again, like Dr. Silva, that we're able to clarify this, but also to really support you, okay? To support you, Brett, in your actions, because I've seen the way you take care of animals and you just do a phenomenal job. So thank you.
I think that's a general feeling about you and your department. So I'm glad we had this chance to clarify all this. So
Thank you. I do appreciate that.
thank you. Thank you. Okay, so now you do have a resolution for us this morning.
Madam Chair.
Yes. Oh, Anita, yes, I'm sorry.
Yes, sorry. No, it's okay. I know when you're just zooming in, you don't get, the attention. Sometimes it's hard to notice. I just also wanted to echo what our other two board members said and actually applaud Dr. Youngstead for coming forward and always looking out for the best interests of the animals in our county. I've had multiple calls in Aurora from people saying, my dog is sick. where can I go? You know, it's time to put my dog down. This is my baby. This is the, you know, member of my family, and I want to do it humanely and I want to do it compassionately, but I don't have the $400 or $500 that the vet charges. So I think that this is a service that in certain circumstances is valuable to our community. And I am fully in support of this. Thank you.
Thank you. Okay, so now the resolution this morning. Mr. Youngstad, you want to?
Sorry, this is the housekeeping matter from finance. It's our yearly credit card procurement cards that just need to be approved by this board and then finance.
Okay. So I need a motion and a second.
So moved.
Second.
Okay, thank you. Any questions? This is just housekeeping, so please call the roll.
Juby? 3-I. Silva? Yes. Carver?
Tarver, yes.
Williams?
Yes.
Young?
Yes.
Sanchez?
Sanchez, yes.
Stratton?
Strathman, yes. Okay, now that will move on to Finance Committee from here. So thank you for your time this morning.
Thank you.
And now we're moving along to, I see Director Michael Isaacson is online with us. Good morning, Michael.
Good morning, everyone. I'll share a couple of comments. I'm sorry I can't be there in person. It's a very exciting meeting, I think, with some special guests we have. So I'll just make a couple of quick comments as we're waiting for the PowerPoint presentation. First, I just want to echo what the board members have said about our director at Animal Control. I've worked very closely on many issues, public health issues that have involved animals, and I'm very thankful to have the expertise and compassion that Dr. Youngstead brings. So I'm very thankful for that. So I want to publicly state that. Also, this is not in my presentation, but today the National County Health Rankings have come out. So this is something, if folks remember, that typically within each state in America, they will rank the health of each county in a couple of different categories. This year, they did it a little bit differently, so they don't have actual rankings. They just compare how counties are doing to others more. It's not a numbered ranking system, but this does allow them to compare us to other counties across the nation. So we will be sharing more information about that at upcoming meetings. I think at the very least, the county health rankings provide a good opportunity for talking points about where we're doing well and where there's opportunities for improvement. There's no new information that comes out. This is all data that we already have access to, but just nationally, it creates an opportunity for health departments to speak. Next slide, please. I do want to say a couple of words about the measles situation in Chicago. And I want to start at a high level and just say measles is a vaccine preventable disease. And this is something that we effectively got rid of in this country because we had a strong vaccine program. Unfortunately, over the last several years, we've started to see more people opting not to vaccinate their children, and that is putting them at risk. And while the United States has done a good job, when we have people come here from other countries, and this is not just an immigration issue, this also occurs when U.S. citizens travel internationally, they may bring measles back. And if people are vaccinated, that's not a problem. But as we see fewer and fewer people getting vaccinated, that becomes a problem. And measles is a very, very serious disease, and it can be quite fatal to, especially to young people. You can see on the slide that 20% of children with measles end up hospitalized. Currently, the situation that we're monitoring and working on in Chicago, there's 15 confirmed cases of measles. You may recall, if you've been following the news, that just recently there was the first case in over 5 years in Chicago. And it's been many, many years since we've had a case of measles in Kane County. But a quick note about what goes into each case of measles and the public health response. And this is a little bit different than COVID, even though it's the same mechanisms. When we identify somebody who has measles, because measles can spread so easily, we even look if somebody's been, say, in a waiting room at an office somewhere, we may look at who's been there even 2 hours after that person left, just because this virus can hang in the air and potentially cause somebody to be sick that never even came into contact with the person who actually had the virus. So the number of exposures to each positive case can be very large. And what we do when we do this investigation is we identify those people and we try to find out how protected they are. Next slide, please. So a couple of things that we're going to look at is age. If somebody is born before 1957, typically before we had our widespread vaccine campaigns, those folks have most likely had, almost assuredly have had measles and have protection. But we have 3 scenarios that we look at. So what if I know that I don't have my measles, mumps, rubella vaccine? Well, the easy thing to do there is to get vaccinated. And that's especially for young people. You can see children need 2 doses during an outbreak. We may change the schedule a little bit. In the second scenario, somebody may say, well, I don't know. I know I got shots, but I can't remember. So we'd ask people to check with their provider. If they're an Illinois resident, they can look it up on the IDPH website to see their vaccine status. And if you're able to prove that you have been vaccinated but you've been exposed, then you're going to want to monitor just to make sure that you don't develop disease. But we have pretty good confidence that you're going to be okay. So either having the natural immunity, being born before 1957, or having a vaccine is the best way to assure your safety. And even if you were to get measles, because no vaccine is 100% effective and efficacy can wane over time, if you did get the disease, it would be much, much less severe. Next slide, please. And then finally, if the person says they do have the vaccine, as I mentioned, you've got great protection. So symptoms are milder, and you can see the numbers there. The 2 doses is 97% effective. So when we lay that across the population, that is how we really build up a good herd immunity in our community. But I'll ask if Director Onwude wants to add anything about this current outbreak. Our team is working very diligently on making sure that we don't have any contacts with any of the cases, and if we do, that we're monitoring them. But Dr. Onwude, anything else you'd like to add?
Good morning, Uche Onwuta, Director of Health Protection. What I'd like to add is that if you have symptoms of measles, we recommend that you call your healthcare provider first before you show up at the emergency room. Because just like Michael said, even if you were there and you leave, up to 2 hours after you leave, anybody that shows up there can be exposed. So rather than expose people who could be immunocompromised, call your physician first, before you leave the house.
Thank you. Thank you, Director Onwude. And one positive thing that I'd like to share is we did get a call for assistance from the Chicago Department of Public Health last weekend, and one of our employees was able to help in Chicago over the weekend as part of the Illinois Public Mutual Aid System. We call it IFMIS. This is a similar system to what police departments and fire departments have, where local jurisdictions can help out if one jurisdiction is being highly taxed. This is something that in Kane County we have taken advantage of ourselves, so where we have had nurses from other jurisdictions come in and help us. Of course, during the COVID pandemic, it wasn't something that was utilized as much because we were all experiencing the same thing at the same time. But in situations like this, It's nice to know that we have this system in place where we can draw on resources from our brother and sister agencies around the state to get assistance. But I'd like to acknowledge one of our communicable disease staff, Andriana, who did volunteer and went and helped in Chicago. And again, wherever there's an outbreak, when you contain it, that helps us. So if we can contain it in Chicago before it comes to Kane County, that's the ideal state. So thank you. Any questions from the board about the measles?
Yes, Dr. Silva.
Not about the measles per se, but I could come up with a scenario where somebody who might have the infection would call the doctor's office, and the doctor's office would say, go to the emergency room or urgent care. How do we prevent that from happening? Can we welcome them to call the health department? I know it's a reportable illness. So do we field calls as well?
Yes. Usually the providers will call us if they suspect measles, and we can advise them on how to get the specimen from the patient to have it tested. And it's usually quick. It comes back within a day.
Oh, it's fast. Okay.
Yeah.
Thank you.
Any other questions or comments? Okay.
All right, great. Well, we'll keep you informed about that as the situation progresses. And now I'm really excited. We've been working on this campaign to prevent overdoses and to help people who may be struggling with opioid use disorders. This is something that we have some very special guests here in the audience today. The team at the health department has been doing an absolutely fantastic job with this. So I'll turn it over to Director Kim Peterson to share some of the great work that's been going on.
Thanks, Michael. I'm Kim Peterson, Director of Community Health at the Health Department. And just to echo what Michael said, we've been working on this communications campaign for a long time now, and we're very glad that it's launching soon. Our goal is to make sure that folks know how to get support, know how to get information, and also really knowing that this opioid crisis doesn't discriminate. It hits all demographics, all groups of people, and it's really been devastating to our residents here in Kane County and wider in the US. So I just want to acknowledge Tina Corral, our Health Promotions Manager, who's going to present here in a few minutes, as well as our other staff working on this project, Assistant Director Michelle Meyer and our grants coordinator, Sharon Cabrera. They've been doing a lot of great work. And in addition, Sharon goes out into the community and does naloxone trainings and gives people really important information about this crisis, how to support the families that are involved, that have folks that are addicted to substances or at risk for overdose. Also to support the folks who are in the middle of this addiction issues or other things. So she is always available to go out and provide that. She also provides a lot of naloxone to many of our community partners throughout the county. And I always say it's like CPR. If you can save a life, why wouldn't you want to be able to? And this is just such an easy way with low risk, very low risk, low side effects to save people and give them a chance. So without further ado, I'll introduce Tina Corral, our Health Promotions Manager, and she will present some more information and some great videos.
Good morning.
Good morning. My name is Tina Corral. I'm the Health Promotions Manager at the Health Department, and I'm here to share with you.
Microphone.
Louder.
We need you to get right up to it there.
Okay. I'm here to share with you our opioid overdose prevention communications campaign. Next slide, please. The goals of the Your Story Matters campaign are to respond to the identification of behavioral health as a priority health need in our last community health assessment, to support the behavioral health communications efforts begun by the Kane County Behavioral Health Council and Kane County government with an overall focus on opioid overdose prevention, and to provide 3 demographics with information, resources, and support. And those 3 groups are individuals with substance use disorder or those at risk of substance use disorder, friends and family of those with substance use disorder, and our healthcare providers and first responders. Next slide, please. So the key messages of the campaign include prevention, treatment, recovery, harm reduction, the message that anyone can be trained to administer naloxone and save lives, and where in the county they can find free naloxone. And then the reduction of stigma by education. So we'll be talking about causes of substance use and misuse, that opioid use disorder and substance use disorder are chronic diseases, and that treatment works and recovery is possible. Next slide, please. So research has shown that when we share the personal stories of stigmatized groups, it has a very powerful destigmatizing effect. And for that reason, we've made the stories of area locals the cornerstone of this campaign. So at this time, I would like to share 3 videos with you so you can hear their stories.
We've got folks that do live in apartments or are housed and come and take supplies. We definitely have folks that come and take, especially like Narcan or test strips for folks they might be concerned about who are using. The homeless folks that I work with, they take care of each other, and that's like part of what we do is preach community and make sure that they have supplies to look out for each other. And I've got plenty of folks that carry a stockpile of safe use supplies even if they might not be using, because they know they're going to be around it and they want to make sure that folks can take what they need and have access to what they need.
And then Blair, I think we have the links for the other 2 videos as well.
We pause for technical difficulties.
While we're waiting, I don't mean to take up more time, so I'll just stop when he does that. If I may have the floor, madam. It's ready.
We knew a little bit about substance use disorders, but in May of 2016, we got a phone call that my son Randy had been found dead of an overdose. Turned out to be from fentanyl.
So he hid it, and he had told his brother he could handle it because he never injected, he was snorting it, and that way he could control it, he could just stop anytime. And he held a job until the day he died. Lived in the city in an apartment with a buddy. You know, had a nice girlfriend, all of that. So we were suspicious at times that there was something else going on, but when you asked him, he was like, I'm not stupid, you know, I wouldn't do that.
It's a lot harder these days to get a legal prescription for a painkiller than it was before. So what does that mean if you're an addict? That means you're going to go to the street. And right now, fentanyl is so cheap and so inexpensive, it's so easy to get. We have people making their own pills.
It's laced into everything.
Yeah.
I tell people too, if you go to the streets and you buy drugs, you are playing Russian roulette with your life, period. There's no getting around that.
But basically, I mean, if someone's going to continue to use what you try to do, you try and keep them alive until they're ready to go into rehabilitation and for recovery. Over half of the people with substance use disorders also have a mental health issue.
Yeah.
So if there's a concern, make sure you're addressing both. Make sure the person gets counseling at the same time that they're working on their recovery.
You use an opioid, you get a burst of dopamine, so that has all of the effects of euphoria and pain control, etc., which can go on for a while where you don't start to develop signs of addiction, but then at some point, probably a month or 2 into regular use, you start to get withdrawal symptoms when you don't use. Because the brain does not like these high spikes of dopamine. The brain likes things nice and steady. Homeostasis is the term. And then so as you are being exposed to these high levels of dopamine from the opioid, your brain is like, whoa, whoa, that's too much dopamine. So it is working to decrease the dopamine. So it's decreasing the receptors, it's decreasing the manufacture of dopamine. So that is developing. So you're developing tolerance. So the mechanism to get dopamine is kind of being shut off. So now you need more opioid just to get a little bit of dopamine.
So these stories and many others will be shared on the Kane Health website. It will be accessed by going to overdoseinfo.org or soberdosisinfo.org. And we're expecting the website to be complete towards the end of this month. Next slide, please. You'll also see this summer in 6 different Kane County bus shelters our promotional materials there. Next slide, please. We'll also have a variety of posters and flyers that we'll provide to our community partners. For example, the one on the left is for partners who carry naloxone, telling folks that they can reach out to staff to get naloxone there for free. The one on the right is directing our healthcare providers and first responders to the website where they can find educational materials and mental health supports. Next slide, please. We'll also be rolling out leave behind kits, and those will go to Kane County law enforcement. And those are intended to be left when law enforcement responds to an overdose call to provide family members and friends the tools to respond to overdoses should that happen again in the future. Next slide, please. In addition, we'll have social media content, educational webinars for the public, healthcare, first responders, press releases, podcasts, radio spots, and then a lot of collaboration with the many different community partner organizations and agencies that we work with in Kane County. So at this point, I'll toss things back to Executive Director Isaacson, and we have some very special guests that we'd like to introduce to you today.
Thank you so much.
Great, thank you, Tina. And again, I just want to applaud the great work that the health department team is doing, putting this together. As Tina said, we're very fortunate to have a strong community support system here in Kane County, and the folks featured in the video today not only are part of telling the compelling story, but they're also out there every day before the health department even became involved in this issue, really making a difference in saving people's lives. So I'd like to invite them up to share a few words with their perspective, because I think it's important for the board to hear these different perspectives from people with direct experience out in the community. So first, I'd like to thank Don and Roberta Kalish for sharing their story, their very personal story, and I'd like to invite them up to the podium if they'd like to say a few words. But thank you again for all that you do. And just so folks know, they also work very diligently to support other families who may have someone who's struggling. Yeah, a great couple here. So thank you. Don, go ahead.
Thank you. This is not easy talking about. I know you.
Talk right into the microphone.
I know you saw the video. So there's an old story about what's the difference between a recession and a depression. A recession is when your neighbor's out of work. A depression is when you're out of work. And that's kind of how the opioid crisis is, and that's how it's affected us. We knew people who had sons. We knew some people who had died from it, and then it hit home. So I don't want to talk very long, but I've seen studies that say 1 out of every 3 families have a family member, a friend, or a relative who are suffering from it. So it's all over. So there's a lot of people in this opioid depression right now. And like Michael said, I'm president of the board of the Path to Recovery Foundation. We don't do rehab. We work with families and individuals. We provide coaching. We don't charge for anything. The only thing we do is we get donations and we get grants. And we've had some small grants from Kane County that have helped us. We work closely with people in the Kane County Jail right now in trying to coach them. So when they're out of jail, hopefully they'll have some guidance on that. So again, thank you for letting us speak here. I wish I didn't have to though. So thank you. My wife Roberta always gets the last word.
Right. That's right. I just wanted to say to everyone too that we raised 4 sons and we lost our youngest son, Randy, in May of 2016. He, there's such a stigma attached to heroin use. And we did not know that until the day he died, that he had been snorting heroin for about 3 years. He had gone to college. He graduated college. He had a really good job. He had a really nice girlfriend. He lived in the city in an apartment with a buddy. So he was what anyone would call, he's appeared to be like a normal young man. He was very personable. There was nothing like odd about him. So just know that this can happen to it can happen to anyone.
Thank you. Thank you both so much for sharing your story. There's nothing more personal. I'd like to invite up Lindsay Hartman, who we have worked with from the very beginning of our naloxone efforts here in the King County Health Department. And Lindsay is always a champion especially for people who may be marginalized in the community. And I've really learned a tremendous amount, and Lindsay's had a very positive impact on all of the efforts that we've done here in King County, and continues to push us to do more. So Lindsay.
Thank you. Oh, I'm really loud, so that's
That's good.
probably. Woo. Thank you so much for having me, and what an honor it was to be able to share my story. I truly cannot overstate the importance of harm reduction services in our county. As a proven public health measure, they save lives and decrease infectious disease spread, but also show people that they are cared for regardless of where they are on their journey. We, my teammates back there, have a commitment to loving and supporting people throughout the entire spectrum of substance use. There is a lot of gray area between substance use and recovery, and harm reduction provides support in that gray. Because of the unwavering support of programs like Street Outreach, participants are 5 times more likely to seek treatment when they have access to harm reduction services. We know how difficult getting into treatment can be, and harm reduction services are a safety net for folks. We get to walk alongside them and ensure their health and safety at every step of the way. The shame that is experienced by people who use drugs is incredibly strong. And we do everything we can to ensure that they know that they are not alone. We cannot have one more person die behind a locked door because they were too ashamed to ask for help. Every overdose is preventable. I've been doing this work for about 7 years, and sometimes the grief and overwhelm is devastating. But having access to naloxone and being able to give it to the folks that need it is truly what keeps me going. So I cannot thank you enough for supporting me and supporting harm reduction services. Thank you.
Great. Thank you so much, Lindsay. And I didn't mention Lindsay is the manager for the Street Outreach program at AID, the Association for Individual Development. So thank you to her and all of her team for the great work they do. And I'd like to call Dr. Steve Holtzford up. Dr. Holtzford, along with Lindsay, are kind of a duo that I've really leaned on the last few years. Dr. Holtzford has been a champion, well, and Lindsay, but with hospitals, Dr. Holtzford's been a champion for many years trying to get our emergency rooms to move to the most evidence-based interventions that we can to help people. And so he's a longtime emergency room physician, currently the medical director at Recovery Centers of America, medical director at Lighthouse. and is working in many other areas. But Dr. Holtzford has seen firsthand what it takes to help people when they're struggling. So, Dr. Holtzford, thanks for being here.
Thank you, Michael. I appreciate the invitation. Yeah, my name is Steve Holtzford, and I was
Right into the microphone.
Oh, my name is Steve Holtzford. I was an ER doctor at Delnor for 23 years. And then about 10 years ago, I started becoming interested in addiction medicine because we were just really inundated with patients that were struggling with substance use disorder. And so it took a little while, but I began to study addiction medicine and slowly kind of extricated myself from the ER. So now I'm exclusively practicing addiction medicine in several different settings. I go to the Kane County Jail on Thursdays. And one of the big things that I'm trying to do is, as Michael kind of said, is to increase the care of patients struggling with substance use disorder within our emergency departments, not only in Kane County, but throughout the state, because as Lindsay alluded to, it's an incredibly stigmatized disease. It is a disease. It is not a moral failure, highly stigmatized, and it's a fascinating disease in the sense that it has biological, psychological, and sociological components. But that's what I really find interesting about it. And also, it is an absolute certainty that patients get better. They really do. All you have to do is you have to treat them with evidence-based treatments, and they, lo and behold, get better. And a lot of that has to do with destigmatizing it, treating it like hypertension or heart failure or diabetes. It is a chronic relapsing brain disease that requires treatment. And a lot of that treatment is community-based. So we're doing a lot of good things in Kane County. We really are. We should be proud of ourselves. I think we talk about being in silos. I think in Kane County, we are kind of in silos. And I think my role as kind of a hospital-based guy is maybe I can sort of break down those silos between hospitals and community providers. That's one of the things I'm trying to do. But in general, Kane County Health Department is doing an outstanding job. I mean, shout out to them, to Michael and his team. And I cannot think of a better use of funds than giving the health department the resources and the facilities that they need. Thanks.
Great. Thank you. Thank you for your comments, Dr. Holtzford. So as you can hear, and thank you again, all four of you, for joining us today and for telling your stories. One common theme is that this was mentioned, as it was mentioned at the beginning. This impacts all of us. It doesn't matter our race, our ethnicity, our income. It can impact anybody. And that's why we've gone with the Your Story Matters, because it's really, these are our friends and loved ones that we're trying to help here. So there are science-based interventions that work, and that has to be led with compassion and giving people hope and treating them like human beings and reducing that stigma. So we're very excited to get this campaign out there, along with all of the other interventions that are going on in the community to really knock back the overdoses that can be prevented. So are there any questions from the board about the campaign?
Yes, Dr. Silva, you first.
Briefly, I love the science-based support that we have, evidence-based initiatives. Are we also looking at faith-based initiatives? That is very important within some folks' manner of thinking and feeling.
Yeah, absolutely. We do work with local faith leaders, and it's sometimes and depending on each individual, we want to start where they are. So for some people, their faith may be an important part of their recovery. So I think with the excellent clinicians that we have out in Kane County who are providing intervention services, we can make those connections. And a big thing that we want to make sure is that our faith leaders know where to go so that they can get that extra assistance. As Dr. Holtzford said, there is a strong biological element to drug use. So it's not just something that we can just talk.
Right.
We can talk out of it, but medications help tremendously.
Absolutely. Okay, thank you.
Yes, Madam Chair.
Thank you very much. I would like to just commend the team, the health department team, for a remarkable campaign. It touched my heart, and I would like to thank all the people who volunteered to support this. You, not only did you touch my heart, my soul, my mind, my very being, with tenderness and love. So I'm so sorry for all of your losses. It saddens me greatly, and I hope that loss will save many, many lives in your efforts. So thank you. Thank you for coming here. I'm wondering now how we're going to distribute this. I asked Brett if he could have it at the animal control. Are we distributing to our schools? Is it going to be distributed to our church pastors in the rectory or in their offices? So it does not become separated from whom their people may be, from who our residents are. Could we have it here? Could there be a distribution center appropriately here at this center, at the clerk's office? You know what I'm saying? I don't know what capacity we have for the amount of materials, because that's obviously a great deal. But how far and wide appropriately can this be distributed so it becomes as common as, gee, do you have an aspirin? No, so that would just be a goal that I think we should try to take a look at if possible.
Michael, would you like to respond to that?
Sure. Yeah. Thank you, Madam Chairman. And we're also always working to get the naloxone and the information out. The team that Director Peterson introduced has been doing a fantastic job. There's just been some changes in internal policy at the state level, so we're able to do more with the schools even. But we have distributed thousands and thousands of doses of naloxone and have record of many lives saved. I've shared the data in the past. I can bring it back next month. And the information we have about lives saved with the naloxone that's distributed through our program, that's just what's reported to us. So we know that that's just scratching the surface, and we like the data, but the most important thing is to get this life-saving medication out into people's hands, to get information about how people can connect to harm reduction services, to treatment so that they can get into recovery. That's the most important thing. And any idea, like the great ideas you mentioned, Madam Chair, we always have to work through the legal process to make sure that where we're putting it is appropriate. But we have had tremendous success and continue to do so.
Yes, Ms. Bates.
I want to thank the health department for coming to the Green Fest last year and handing out Narcan. I was so excited that you were there and helping with this important cause, important issue. My heart goes out to the family, of course. The Green Fest is coming on June 8th. I hope you'll get signed up and come again. And I have a little story about when I was an acupuncturist, and a man was coming to me for back pain. Everybody, it seems like, has back pain, especially when you're an acupuncturist. But this man was self-medicating with heroin. He hadn't gone over the edge yet. I don't know what happened to him. He didn't come to me for very long, but he couldn't come on Saturdays because he was a Boy Scout leader. He was a Boy Scout troop leader, so he couldn't come on Saturdays. I mean, that's just, I'm trying to say that every walk of life can have this happen to them. So.
Yes, Mr. Kais.
Well, on the tenor of the Every Story Counts, I'd like to thank the presentation and the outreach we're doing here in Kane County now. I know in our family, our time of need, of most need, was some time ago, and we had to go to Arlington Heights or to join a friends and family group where we met regularly, which helped us get through. And it's very important that it happens here in Kane County.
Yes, I would like to add my own story, and that is I went to training on how to administer the Narcan, or the, I can never say it correctly, Naloxone.
That's why they call it
That,
Narcan.
that's why we call it Narcan. And going away from that training, I had 2 samples, and I gave them to my grandkids who live in Chicago. One is a young man in the working world, and the other one is a senior in college. And they said to me, why are you giving this to me? And I said, well, I'm hoping that you know, and we talked about, you know, addiction and this remedy. And I said, you're in a target rich zone. You're much more likely to see somebody than I am in the suburbs where I am, you know, with their group. And after we got done discussing it, they were very happy to have it. In fact, my granddaughter's roommate is a bartender. And so she said, can I have one for her? So it's, you know, it's up to us to get this story out and how we can all work and support each other. And it's so wonderful that it's happening right here in King County. So thank you for a wonderful presentation this morning. That was absolutely wonderful. Thank you.
Madam Chair Gums.
Oh, I'm sorry, Ms. Gums.
I'm not on the committee, but if I may.
Yes.
As I always do, I just want to applaud this committee for all the great work, especially on this topic. I'm not going to look at many people here, but as you know, my brother's story is very impressive. And although we lose people along the way, my brother was a police officer and he got addicted to pain medication because of a car accident. He broke his neck and they gave him oxycodone for a year while he was in a halo. And then it went down south from there. He was a police officer for 18 years. He was not only the police officer of the year once, but he was a police officer of the year twice here in King County. Homicide detective. Then he went from that to, and I'm glad the doctor is here because this is something that doesn't get talked about is, you know, you can follow a group of individuals through the process of when OxyContin started to the overdose rate now, and it follows the trend of people that were first addicted to this. Because the pain medication became more difficult to get through the doctor's office. That's where the overdoses occur, is with bad medicine. My brother was dead twice, but they brought him back. And I am here to tell you that not only is he thriving, but he is in the mix with Kane County right now, helping the people in this county to get better. So go team, and I love you all. Thank you.
Dr. Silva?
Thank you. Briefly, I would like to share some substance use trends in King County with juveniles, and this information comes from the King County Health Department. So the substances in question that are youth are more, the average age of use is 14 years old. The substances that they are most likely to use are alcohol, marijuana, and vaping. Regarding marijuana, lots of kids don't know that they can be charged with a DUI if there's THC. It increases panic attacks and can lower testosterone. Regarding vaping, this is one of the most common things that they use, and it's being, this is where the education needs to come in, because we need to understand what are the uses, how it's used, what's entailed, but it's out there. So vaping is a very common one, and I'm sorry, I'm a little not organized in this. I'm just reading off of my notes, but those 3 things are the ones that we need to look at when it comes to juvenile substance use.
Thank you. Any other comments or questions? Okay, back to you, Mr. Isaacson.
Great, thank you. And I thank you again to our speakers, and on our YouTube channel, you can see all of the videos that were made. And in addition to the three vignettes that you saw. We have several other stories that are also very powerful. So I encourage you to go to the Kane County Health Department's YouTube channel to view those. But moving on, we'll go to our first resolution, and this is authorizing the health department to purchase mosquito larvicide. So of course, as it becomes West Nile season later in the summer, the most effective way to push back mosquitoes is to get rid of them when they're young, when they're larvae. So this allows us to purchase dunks that can be put into standing water to kill the larva. Director Onwuda, is there anything else that you want to add about this particular resolution?
Thank you, Director Isaacson. So the larvicide will provide to municipalities and vendors that are within Kane County. We've been doing this for several years. So we always come every year at this time for that. Thank you.
Okay.
And it is 100% grant funded.
Okay. So could I have a motion and a second to move this resolution forward?
So moved. Silva seconds.
Thank you. Any questions or comments? Yes, Ms. Bates?
Is this herbicide or insecticide that's being used environmentally friendly?
Did you hear the question, Mr. Isaacson?
Yes, I'll defer to, I believe it is, but Director.
Yes, it
Onwuda.
is. Yeah.
Okay. Okay. So clerk, please call the roll.
Juby? Juby, aye. Silva? Silva, yes. Tarver?
Tarver, yes.
Williams?
Yes.
Young?
Yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes.
Passes.
Motion passes. Okay. Back to you, Mr. Isaacson.
Sure. And the second resolution is just the pro forma authorizing the number of procurement cards issued to Kane County Public Health Department and each of their transaction limits. You'll see that we do have just one card that's issued to the health department. This is the same resolution that's going through all offices and departments right now.
So this is housekeeping. So-
Housekeeping, yes, ma'am.
So could I have a motion and a second?
A motion.
Second.
Young and Juby, thank you. Any questions? Please call the roll.
Juby? Juby, aye. Silva? Silva, yes. Tarver?
Tarver, yes.
Williams?
Yes.
Young?
Yes.
Sanchez?
Sanchez, yes.
Strathman?
Yes. Okay. Do we have any old business this morning? Okay. And I'd like a motion and a second to replace the reports on file. Silva moves. Do I have a second?
Second.
Mr. Young, thank you. Okay, please call the roll.
Voice vote.
I guess we can do a voice vote. All in favor, say aye.
Aye.
I don't believe we have any need for executive session this morning. So thank you. And new business.
Chair Sanchez here.
Yes, Mr. Sanchez.
I just wanted to share just a small bit of news from up in my neck of the woods. The Dunny Township Mental Health Board has just completed their needs assessment, and it's online on the Dunny Township website. And it's a big step forward, a big milestone for that group. It's been kind of a contentious history. They were locked up in litigation for a little while and had their first round of funding just last year, but now they have their needs assessment done. So I'm looking forward to the work that they'll be able to do in, mental health and developmental disabilities, and then especially addiction, as we were talking about today. So I just wanted to let everybody know about that.
Thank you. That's good news. Thank you. And good news for the whole area up here. Any other new business? Okay, then I'd like to take a motion and a second to adjourn.
Tarver moves.
Young and Tarver, I thought everybody wanted to stay. Okay, everyone in favor, say aye. Thank you. Thank you for a wonderful